Okay, think about this for a second. A whole country's doctors, nurses, walking out, the very people you rely on when you're sick. It sounds, well, almost unbelievable, right? But that's exactly what we saw unfold in Ethiopia back in May 2025. A nationwide strike by health professionals. It became a startling reality.
And it wasn't just out of the blue. Our look into this shows a really long, troubling history that sort of built up to this moment. And then there's the government's reaction, which frankly raises some serious questions.
Yeah.
So today we're going to dig into why this strike happened, how the government responded, and the ripple effects we're seeing now.
Exactly. We want to give you a clear picture of the core issues here. Not get bogged down in every single detail, but really focus on what sparked the strike and the surprisingly forceful response. Okay, let's get into it. What were the deep-seated problems? What really led Ethiopia's healthcare workers to take this kind of drastic step?
Well, like I said, this wasn't sudden. It was more like a pot boiling over after decades of the healthcare system just not getting the investment it needed. Chronic underfunding. It fueled a massive brain drain. Skilled doctors and nurses leaving for better jobs elsewhere. And the ones who stayed, they were left dealing with constant pressure, humanitarian crises, just stretched incredibly thin.
Stretched thin is putting it mildly based on the numbers.
Yeah, the stats are pretty stark. Ethiopia has something like 0.76 doctors for every 10,000 people. The WHO, the World Health Organization, recommends at least 1 per 1,000.
Wow.
So you're looking at one doctor trying to care for over 13,000 patients.
Well,
it's impossible.
Just an overwhelming caseload. And it wasn't just about being overworked, right? Our sources mention a real living crisis for these professionals.
Absolutely. That's a key part of it. Their monthly pay is incredibly low, maybe $200, $400 a month, way below what people might earn elsewhere in the region. And then add to that the constant lack of basic supplies. We're talking essential medicines, gloves, even oxygen sometimes.
So they're working in these really tough conditions while struggling to make ends meet themselves.
Precisely. Trying to save lives without the basic tools while facing their own economic hardship.
And these complaints, these grievances, they weren't new, were they? The analysis points to them being ignored for a long time.
That's right. The main union, the Ethiopian Health Professionals Association, or EHPA, they'd put in formal requests way back in March 2023. But really, some of these problems had been on the table unaddressed for more than 5 years.
5 years, okay.
It really suggests a pattern, a failure by the government to prioritize the needs of these essential workers.
So what was the final straw? What pushed them over the edge to actually strike?
It looks like the catalyst was the rising cost of living. Inflation was hitting hard across Ethiopia. Basics like housing, food, transport, the prices were soaring. And that economic pressure just seems to have been the breaking point.
It really pushed them into action. But it wasn't impulsive. There was a buildup, a clear process.
Definitely. It started building momentum online around April 8th, 2025.
Yeah.
You saw hashtags like #HealthWorkersMatter, #PayHealthWorkersFairly, getting traction on social media, raising awareness. Then, on April 11th, they formally presented a list of 12 specific demands to the government. Initially, they gave a 30-day deadline. But later, they shortened that quite significantly.
How short?
Down to a 10-day ultimatum, basically saying meet these demands by May 11th or 12th, or we strike.
Okay, so a firm deadline. And what were they asking for specifically, those 12 demands?
The core demands were pretty fundamental. A significant pay rise, obviously, getting paid properly and on time for overtime,
Right.
Free health insurance for themselves and their families, help with housing or land, and free transport to work.
Basic necessities for professionals doing critical work.
Exactly. And there was also a specific demand for the Tigray region. Health workers there hadn't been paid for 17 months because of the conflict. They demanded those back wages.
17 months unpaid. That's unbelievable. So a strong set of demands. How did the strike itself actually play out? It wasn't an immediate shutdown, right?
No, they escalated things carefully. On May 13th, they started with a partial work stoppage. But crucially, they kept emergency rooms, ICUs, maternity wards, and kids departments running.
Okay, so trying to minimize harm initially.
Right. Reports from Addis Ababa suggested it was mainly outpatient services that were hit at first. It showed they were serious, but also trying to grapple with that ethical dilemma, balancing their demands with patient care.
A calculated move, then? But it didn't stay partial for long.
No. By May 19th, it had escalated to a full nationwide strike. And that's when things got really serious. Many hospitals became basically non-operational, We heard reports of even critical places like labor wards and ICUs closing down in some areas.
Whoa.
So that progression from clear demands, the ultimatum, the partial strike, then the full shutdown, it really highlights how desperate they felt and perhaps how unwilling the government was to talk.
A nation's healthcare system grinding to a halt. Now let's pivot to the government's reaction. Our analysis suggests it wasn't exactly about negotiation.
No, not at all. The response was overwhelmingly defined by, well, repression and intimidation. Right from May 13th, when the partial strike began, there were reports of government officials showing up at hospitals.
Just being there.
Yeah, creating this atmosphere of fear. And arrests started happening even before the full strike kicked in.
Arrests. For striking.
Or even just for showing support. Our analysis found at least 10 arrests reported from May 7th onwards, including 3 doctors at one hospital, a Garo general, apparently just for sharing photos supporting the protest online.
Simply sharing photos. That's
Yeah.
concerning for freedom of expression.
Absolutely. And then, perhaps most significantly, Dr. Yonatan Dagnu, the president of the HPA, the Health Workers Association, was arrested on May 11th. There were some initial releases, but then the numbers climbed fast. Reports suggested at least 80 health professionals were detained.
80. That's a significant number. And there was that specific incident at Akesta General Hospital.
Yeah, that one really stands out. A doctor was detained, threatened, basically go back to work or go to prison.
How was that resolved?
It was incredible, actually. His colleagues, even those striking from home, apparently volunteered to take his place in prison. That solidarity forced the authorities to release him.
Wow. Shows the strength of their resolve, but also the pressure they were under.
Exactly.
Yeah.
And tragically, we also heard that medical staff in some areas actually went into hiding to avoid being arrested or intimidated.
Hiding from their own government just for demanding better conditions. Beyond arrest, though, there was another, even more extreme tactic mentioned in our analysis: forced conscription.
Yes, this is incredibly serious. Reports emerged that striking doctors were being drafted into the military, using emergency decrees, calling it national duty.
So basically forcing them into service to break the strike.
It appears so. Some were apparently compelled to work in military camps, literally under the threat of jail time if they refused. This really goes way beyond managing a labor dispute. It feels like using state power coercively.
And while all this was happening, what was the official story? What was the government saying publicly?
Well, the public message was very different. Lots of official denials and what looks like state-sponsored propaganda. The health minister, Dr. Mekistaba, claimed everything was fine. Professionals were working, hospitals were fully operational. She acknowledged maybe some limited service interruptions, but insisted they were quickly fixed.
Which sounds completely at odds with reports of nationwide shutdowns and closed ICUs.
Completely. The ministry also put out warnings, saying professionals were being misled or had malicious intentions.
Trying to discredit them.
Exactly. State media jumped on this, painting the doctors as traitors or even agents of opposition groups like the OLA or FANO, accusing them of abandoning patients. The deputy health minister chimed in too, claiming unnamed people were trying to hijack the strike for political reasons.
So a concerted effort to shape the narrative and delegitimize the strike.
Absolutely. And alongside this, they issued legal warnings.
Ah, yes. They claimed the strike itself was illegal.
Right. The Ministry of Health stated very clearly that health sector strikes were legally prohibited. They ordered everyone back to work immediately, threatening legal action under something called Proclamation Number 13622-2017.
Okay, Proclamation 1362017. What does that actually say?
Well, here's where it gets interesting. Our analysis looked into this, and that specific proclamation mostly deals with healthcare administration, things like end-of-life care, organ donation rules. It doesn't actually seem to contain an explicit ban on health sector strikes.
So the main legal justification they cited might not even apply directly.
It seems questionable, yeah.
Love that.
It looks more like they pointed to an administrative law, perhaps hoping people wouldn't check the details. A bit of a red herring, maybe.
But that doesn't mean there aren't other laws that could be relevant, right?
Yeah, correct. Ethiopia does have other laws. There's Labor Proclamation Number 377-2003, which does ban strikes in essential services, and hospitals are explicitly listed as essential.
Okay, so that one is relevant.
Yes. And there's also a general prohibition on strikes by public servants in the Civil Servants Proclamation. Plus, the criminal code has penalties for illegal strikes in the public sector.
So, legally complex. They might have grounds under other laws, even if the first one they cited was shaky.
Precisely. Which brings us neatly into the whole legal and human rights side of this. There's a real tension here.
Between Ethiopia's own laws and international standards.
Exactly. Ethiopia has actually signed up to key international labor agreements, ILO Conventions 87 and 98. These protect freedom of association and the right to bargain collectively. And the ILO, the International Labor Organization, generally sees the right to strike as fundamental for workers.
But they do allow restrictions for essential services, like hospitals.
They do. The ILO acknowledges that you can limit strikes in essential services and for certain public servants. But, and this is the crucial part, our analysis highlights there's a big condition.
Righteous.
If you restrict the right to strike, you must provide adequate compensatory guarantees. That means things like fair and impartial conciliation or arbitration processes, ways to resolve the dispute peacefully where both sides get a real hearing.
And were those guarantees provided here?
Not according to the reports. Instead of dialogue or arbitration, the government response was dominated by repression, the arrests, the intimidation we talked about. The EHPA itself said they faced silence, threats, and misinformation from the government side. No real attempt at negotiation.
So even if Ethiopian law allows strike restrictions, the way the government handled it seems to violate the spirit, if not the letter, of those international standards by not offering those alternatives.
That's a fair assessment. And from a broader human rights perspective, the criticism has been sharp. Amnesty International, AEPAC, they've both put out strong statements, calling for the release of the detained health workers, stressing the right to peaceful assembly.
Right. And our analysis also puts us into a wider context, doesn't it? A pattern of human rights issues in Ethiopia, documented by groups like Human Rights Watch.
Yes, sadly. HRW has reported for years on patterns of arbitrary arrests, detention without trial, intimidation of critics, journalists, activists, opposition figures. They've even documented specific attacks on healthcare in conflict zones, staff being beaten, arrested, medical transport blocked.
So the way the government responded to this strike, unfortunately, seems to fit into that larger, troubling picture.
It does appear consistent with that trend, yes. A trend of suppressing dissent rather than addressing grievances.
It's a deeply concerning pattern, and the immediate fallout from the strike and this crackdown, it's been devastating for ordinary people, hasn't it?
Absolutely devastating. Our analysis points to a near-complete paralysis of healthcare services during the peak of the strike. Patients suffered immensely. Major hospitals, especially in Addis, Oromia, Amhara, largely shut down. We saw widespread reports of people being turned away, waiting hours for urgent care. Critical departments like maternity and ICUs closed in some places.
Just terrible.
Yeah. Regional health bodies, the Ethiopian Medical Association, the Public Health Association, they all warned about the severe harm being caused. This directly leads to preventable deaths, preventable suffering. There's no other way to put it.
And beyond that immediate tragic impact, what about the longer-term damage? We touched on brain drain earlier.
Right. And this situation is almost guaranteed to make that worse, much worse. Why would skilled doctors and nurses want to stay in a system where demanding fair treatment leads to arrest or forced conscription?
It's a powerful disincentive.
Exactly. We're already hearing reports of professionals looking for asylum, planning to move to private clinics. Remember that terrible doctor-patient ratio. This exodus will just hammer it further down. It undermines the whole future of Ethiopia's health system.
It's discouraging future generations from even entering the field, potentially.
Precisely. Who would choose that path under these conditions?
And finally, there's the broader impact. Erosion of trust, potential for wider unrest. This feels bigger than just one sector's labor dispute.
It definitely has that potential.
Yeah.
Our analysis suggests public opinion might be turning against the government over its handling of this. People see the suffering, they hear the doctor's stories, and they blame the authorities.
Which could lead to?
Well, there's a risk of radicalization, maybe protests spreading to other groups like teachers or university staff who might have similar complaints. Opposition parties are already warning about national chaos.
And the government labeling strikers as traitors or terrorists probably doesn't help calm things down.
No, it just deepens the divisions. It politicizes what started as a legitimate plea for better working conditions. The fact that this strike was so unified across different regions, that tells you something. It suggests a really deep shared sense of grievance. And historically, when governments clamp down hard on legitimate worker demands, it can sometimes spiral to much broader social and political crises.
So wrapping this up, what we've seen is a healthcare system pushed to the brink by years of neglect. This led to a nationwide strike rooted in genuine, serious grievances about pay, conditions, and basic supplies. The government's response: overwhelmingly repressive. Arrests, intimidation, questionable legal justifications, seemingly ignoring international labor norms.
And the consequences are dire. Immediate suffering for patients, a likely acceleration of the brain drain that cripples the system long term, and this growing erosion of public trust, potentially fueling wider instability.
It really leaves you with a stark question, doesn't it?
It does. What happens in the long run when a government chooses suppression over addressing the basic needs of its essential workers? What kind of damage does that do to the relationship between the state and its citizens and to the health of the nation itself? It could be irreversible.
Definitely something to think about. That delicate balance between state power, workers' rights, and the fundamental human right to health care. We hope this deep dive has given you a clearer understanding of this complex and concerning situation. Thanks for joining.